What is up, everyone? We are back again at it with Dr. Kupperman, Dr. D'Anna. I myself am Seth and we have Lori Gruskin with us. So today we're going to be talking about practice management. So Dr. Kupperman, Dr. D, can you guys tell me what is your style of practice like? What are some of the things that you're doing every day to day? What's your practice size, location, procedure mix, all that sort of stuff?
Okay, so let's start with the kind of types of practices we run. We're fee-for-service, PPO. We don't take any kind of Medicaid or HMO, so that kind of helps explain what type of office we are. Mm-hmm. For clinical stuff management-wise, I'm a firm believer in clinical autonomy. So I like when the doctors work on their own. They do on their own. They practice at their discretion. There's no pressure on them to do, procedures that they don't want to do. It's kind of their treatment planning, and it's on their terms. The 5 offices that we currently have, we have a 6-op office on FSU's campus. We have a 7-op office in Perry. We have a 4-operatory office in a retirement village over in Dowling Park. We have a 5-op office, another one in the north side of Tallahassee, and then we have a 5-op office in Panacea, Florida, which is kind of closer to the beach.
So that's a lot of different demographics.
Yeah, that's a lot of different demographics. It's a lot of market share. I mean, we're probably looking at, say, over 30,000 patients conservatively, so it's definitely a good market share. The offices, too, it's kind of cool because, what initially inspired me to even buy these first 3 offices is the type of doctors that had worked there. Mm-hmm. And, Dr. D can agree with me, too. It's pretty miraculous how they just have all, the bells and whistles and all these cool different clinical things where that it was a dentist that kind of, put it together. It was a dentist that, set up the instrument regime, which is really fascinating. I don't know if you have anything to add on that.
Yeah, so it's, it's everything. I can't think of really one specific procedure. So right. I started off at the at the Health and Wellness Center here at the FSU office, and it's basic 1-tooth dentistry, root canal, crown and build up.
Is almost everybody here like under 30?
A lot, yeah. But I see all all types of patients, every age group. Mm-hmm. People that work for the for the state.
Oh, okay. Yeah.
So gotcha. See a lot of that, but this office a lot of younger kids. Trauma, going out, Monday morning, they're busting their teeth. Yeah. They're like, hey, doc, what are we doing here? Yeah. Invisalign, wisdom teeth, but more simple stuff, kind of, it almost feels like dental school there. And then but now I'm at, let's say Monday I start there, and then Tuesday I'm in Perry, which is, very rural office, southern vibes, salt of the earth people, just great people that really respect you and, those type of. It's complex stuff.
Right.
More like collapsed bites.
Yeah.
A lot of drug-induced tooth loss.
Uh-huh.
So there it gets more comprehensive, and then so I go through all the offices, and then you have Dowling Park, which is hour and 15 minutes out of Tallahassee, and it's inside of a retirement village. Mm-hmm. So, but it's a retirement village, but then you also have a lot of people coming from the surrounding counties. So I'm jumping in a room with a 96-year-old patient, and then the next room's a 6-year-old. So it's it's all over. So these patients are medically compromised. It's that. I would say that's my favorite office for some reason. I don't know what it is, but it's it's just a beautiful vibe and community. And then the other office is in Tallahassee, fee for service, high profile clients that it's in the beginning I was nervous, you don't realize it, but then the other doc would be like, oh, this guy's owns this. I was like, man, I'm not ready for this. You just get nervous, but there is again just crown and bridge, root canals.
Okay. Yeah. So what's kind of your schedule 5 days a week, and what's your hours like also?
I'm 4.5, so Monday through Thursday now I'm going, my schedule kind of changed, but Monday through Thursday I go to the rural offices, and then Friday's just a half day at FSU, and just a lot of emergencies, a lot of wisdom teeth, a lot of trauma, but more basic stuff, so.
Okay. How about you, Dr. Kupperman?
One of the biggest things too, Dr. D is just very passionate about dentistry in general. He works 4.5 days a week, but typically, I think a doctor for longevity, you really only want to work about 4 days a week long term. So that's like a really big piece of advice. So for me, it kind of varies because I kind of float around the offices and kind of do more specialty procedures like implants and a lot of surgery. So sometimes my work week is say a day, and then the rest of it's committed to administrative stuff, and then other weeks I'll work 2 or 3 days. So that's kind of what my schedule is. But the fortunate thing too, I think, about our office network is it's kind of set up for education. It's set up to slowly, gradually intro you into more clinically developed, more clinically complex cases, because you kind of come to FSU and you're seeing kids and you're literally just doing fill-ins. I mean, it's literally like dental school. So you're kind of getting your feet wet. You're feeling it out. You're doing really straightforward procedures, and then you slowly kind of start to get thrown into the lion's den, or you're in Perry or you're in Dowling Park, medically compromised patients that have tons of like rampant decay or missing a lot of teeth or collapsed bites, TMJ. So it starts to get a little bit more advanced, but you can kind of progress as slowly or as quickly as you want to, and that's kind of what gives you that comfort zone.
That's
again,
awesome.
And again, back to the doctor mentorship, to where if you're in it over your head, you got doctors that are been practicing for 40 years that you can kind of call up and ask for advice.
That's cool.
Yeah. With that said, like there's been a lot of times where I'm very overwhelmed, but it's been nice because I know I'm not alone. Like whether Dr. Kupperman's there or I can call him, I call the other doctors, whether it's Dr. Morgan, and they're there. They're there to help. I've sat down with some of the older docs, gone over a lot of the comprehensive cases, and I mean that's helped me a lot, because there's no way I'd be able to treat these patients like the right way without some help.
Yeah, and one thing too that's remarkable is we have these amazing iTero Element 2 scanners, to where you can do full digital mounted models in a matter of 2 minutes, and it's uploaded to a cloud. So when you want to kind of review treatment plans, you have 2 doctors on the computer, and you can sit there and you can pull up a 3D image model. You can look at how the bite is, and you can look at it in color. You can look at it normal, and you can seriously sit there and you can do a full blown treatment plan, and then you can literally send it off to the lab, and they can fabricate prosthetics and stuff for you using that. So it's pretty state of the art, and it's just really
that's wild. I mean, it's almost like you don't need the patient there, right?
Yeah.
So do you scan like every single patient that comes in for the COE, or?
Not every single patient. Typically, if it's something that's more advanced, if it's just a super basic patient, it's kind of a waste of time if they have perfect teeth.
Yeah.
But if somebody that has extensive work to be done, it's a lot easier to sit there, do the scan, pull it up. You can go maxillary arch, lower arch. You can zoom in on kind of like the work that needs to be done. Another thing, obviously, you need to do it for Invisalign, and then you can pull up those ClinChecks before and after within a matter of minutes, which is pretty fantastic. But yeah, obviously for crown and bridge, for implants, we scan, but that makes everything so much more accurate, because you're literally taking 6,000 pictures of the tooth, wrapping around it, 6,000 at this angle, 6,000 at this angle. Your accuracy of like crowns, I mean, they're dropping in, and your margins are squeaky tight. So it's a really, really cool thing.
Right.
In regards to the technology, are you thinking about getting a CEREC within any of your offices, or do you have one at the moment?
So I keep seeing these advertisements about CERECs that can like print a crown in like 5 minutes. If it gets to that point, I would definitely consider pulling the trigger. But I just don't know. These machines are new. I don't know. what the longevity on them is. I don't necessarily know how expensive they are. But for me, it's like the crown in a day appointment where somebody has to be in the chair for 4 hours. I'm not sold on it quite yet. I know there's some doctors that really like to do it, but for me, I just don't think it works for the business model right now.
Right, because I see you have some of those. What do they call it? The vacation dentistry, or what's it called? Dental tourism or something. And patients will like fly into these really nice offices. The offices will be like, all like spot up, and that's what it's really there for the patients that are willing to spend half a day. But speaking of that, I just went to DSG Dental Lab. That's in St. Pete, and they were saying like CEREC, CAD/CAM, all that is going to be out of here sooner or later, because 3D printing, they're just going to be 3D printing ceramics, and that's like the biggest roadblock right now, is like just with materials technology. So once they figure that out, they're going to be 3D printing crowns and stuff like that. So.
Yeah, I know iTero Align, I believe, just purchased a CAD CAM company.
Okay.
So that's an interesting development that's going on too.
Mm-hmm.
So who knows? Maybe Align and Itera are going to come out with their own, printer. So
That would be that'd be wild.
Yeah.
So what's going back to the business? What's kind of like some of the best business advice? I know it's a broad question, but what's something that really like stood out to you when you're kind of coming up and learning a lot about business?
The biggest thing that kind of comes back to the E-myth is cash flow. So that's your lifeline. That's the number one thing. You have to have more money coming in than money that's coming out. You have to have reserves. You have to have a safety fund, which I think a lot of people are realizing is very important right now, especially in this period of time. But that's probably, that's the oxygen for you right there.
Right.
And then obviously there's a lot of other things that go along with HR management and leadership. But
Yeah.
How about you, Dr. D? What do you think in here?
From what I've seen,
HR.
it gets to the point where, and I always used to ask dentists when I was shadowing dentists, and be like, what's the hardest thing, or what, and they would always, every single one would say, like, I can teach anyone to do this. It's the other stuff, the business side, so the employees, the staff. It's
Right.
really about like being able to lead a team and effectively, and yeah.
So what's like some of the problems that you guys run into? Because I mean, you see a lot of the stuff that Mark Costas says is just like make your operations manual and get all your protocols written out.
Yeah.
But like you can do that and you can hand it to your employees, to your team members, and they can just not read it. Like, so how do you deal with all that?
Yeah, well, you have the manual, and it's good to have as a reference. And at the end of the day, we're not working with robots. We're working with human beings that have feelings.
Yeah.
I mean, with all due respect, women can be emotional at times, and it's like a roller coaster. Sometimes you have all the women are emotional at once, and then other times it's just, flowers and roses, and you kind of never know what you're going to get. But ultimately, you have to have a chain of command. That's one of the most important things. So you kind of delegate
Right.
and elevate. It's
Right.
like probably
Delegate. All right,
delegate,
let me write that down.
This is a good theme for this podcast. So you basically have levels of command and levels of leadership to where it can be kind of sectioned out and resolved on a lower level, and if it needs to be escalated, it can be escalated. So yeah, I think that's probably one of the best ways to handle that.
And with now that I always think of Mark Costas and stuff. He's always talking about systems and systems. That is so important, because if your systems start breaking down, everything starts breaking down. Whether it's like onboarding new people or just day-to-day stuff. So you need to have systems in place. I think like we've had them. We've had systems in place and stuff. And then as we've gotten more offices and stuff, you just need to make sure it's consistent. And you got to and like Dr. Morgan says, KISS.
Yeah.
Keep it simple, stupid.
Yeah.
And that's what we try to do. And so whether it's clinical or business, that part, it's you got to have the systems in place.
Okay, cool. So what's kind of the best marketing advice? This is like, I mean, we spoke about how your offices are very different. You have different demographics. I mean, maybe some places billboards might work, but then other places you don't even need to do like visual. You can just do like all online stuff, Facebook marketing.
Yeah, well, I mean, obviously every dentist is going to tell you this, but word of mouth is going to be the absolute best. Internal referrals are going to be the absolute best thing. For our office, especially at FSU, it's a little bit different. People just have to know we exist. We're smack dab in the middle of 45,000 students. So as long as people know we exist, they don't really have anywhere else to go. So it's kind of like a different situation. Whereas like these more rural offices, I mean, the lifeline is the phone and, direct referrals. I mean, obviously, you want to have a good mobile-friendly website, which is good. I've been getting, quite a bit of traction with like Facebook ads and being able to target, certain demographics. And again, too, as Howard Ferrand always says that 90% of dental appointments are made by females.
Right.
So that's another thing too. I like to target market females. So that's kind of
Okay. Yeah, that's some good advice.
Trying to think anything else marketing wise. I mean, we have the FSU offices market on the jumbotron during the football games.
That's
We have
cool.
a big banner out in the FSU baseball field. So I think there's more marketing involved for FSU than any of the other offices. But I mean, obviously you got to have like a Facebook page too,
Yeah.
which is pretty critical, and then a Google a Google page, which is good with like good reviews.
How did you get the office within FSU? Because a few years ago when I was here at school, there wasn't a dental office.
Well, again, too, that comes back to the story of me acquiring the 3 offices at once. It was kind of like a package deal to where the doctor had his rural offices, but his son had just started this office, and his son, was tragically killed. So he basically owned all 3. So that's how I kind of got it, like in one.
Is it hard dealing with a university?
Not at all. Honestly, FSU has been absolutely amazing. I think they're just happy to have us. I mean, you have high quality doctors that are serving these students when like a lot of surrounding practices, they don't want to have to deal with the students because it's like the parents that they have to deal with, not with the students. So because there's a lot of there's a lot of miscommunication there. But yeah, I think FSU is happy to have us. It's just been a great relationship that I've had with them. I mean, I'm a diehard brainwashed Seminole, so I just love being here.
I feel you.
Still love our football team. Hoping Norvell brings us back to greatness.
Let's hope so.
Yeah.
Yeah. Okay, so a little bit of Facebook marketing, because we talk a lot about social media with a lot of our listeners. So how about like Instagram and Twitter and stuff like that? Because you know how they say that, okay, I heard this the other day, like 60% of Facebook users are like over 40 years old.
And that's why for the FSU, I hammer on Instagram. Big time. So I have the guys that do the marketing for all like the nightclubs for the students. I have the same guy doing the marketing for the students.
That's funny.
That's literally, that's who they know. They know the student population, and that has just been, it's been wildly, popular. Whereas, I can't believe how far that page has come within, a year. So, yeah.
Do you have a hard time with the FSU students keeping their appointments because they're so young and they might not care?
We definitely probably have cancellations, but I don't know, we just see so many patients. If they cancel, there's just like 50 other people that need to come in that day, so it's not like too big of a deal, honestly.
Right. You got a little bit of a buffer. So, okay. So when you're really breaking down your office, okay, so Dr. D, what is some leadership advice you would give to a dentist that's got poor team culture? It is tough. Because that's what a lot of dentists are struggling with.
Poor team culture, man. That is just like a killer in any office. And I think one of the biggest things with poor team culture is people don't know what the company is about. People don't know what the core values are. They're just kind of lost, They want somebody to follow. People, a lot of people, most people want leaders. They want great leaders. And you have to basically illustrate to them what your core values are, what your vision is. And then, once they have that down, then you also have to have, like some fun. Like, you got to be laid back. It's got to be a cordial environment. You got to do, company events where you guys just like hang out, grab a drink, or like, go bowling, do something, do some fun stuff. Like that's where it starts with. Another thing is too, is like, you sometimes you have valuable employees that are kind of rotten apples where they're good fiscally, but they're not good.
They're not good for the team.
Yeah, not good for the team. And that's some of the hardest things I think that all practice owners struggle with. So sometimes it's better just to kind of cut the rotten apples as soon as you can.
Right. That's what I hear a lot, like just get rid of them early, unfortunately. So how about the dentists? Sorry, Dr. D, but Dr. K. So when you're hiring new dentists and they're struggling in case acceptance, how do you help them out, train them to improve that?
Okay, so it all starts with one thing. It's not about how much you know, it's about how much you care. Okay. That's one of the number one things.
There you go. I write that one down too.
You have to have an emotional connection with the patient. You have to show them that you care. You have to show them that you're really there for them. Otherwise, if they get a hint of you're on another level of them, you're a doctor, you know more, this and that. Another thing too, which one of the first things I taught to Dr. D, you got to break things down in layman's terms. You can't do clinical. We speak Latin, we speak a different language. You have to break it down to where they understand it. So you create an emotional connection, which you care about the patient. We don't care about our patients. And then when you explain the treatment to them, you don't make it like rocket science. You just make it very straightforward.
Right.
This is what you need. You can have the option of doing nothing. The ball's in your court. And I think if you get that mentality, your case acceptance kind of goes through the roof. And that's one of the biggest things. And interestingly enough, I use Dental Intel, which is a good program that kind of monitors a treatment case acceptance for doctors. So you can kind of monitor that. And it's funny, when you tell doctors, this whole thing, and then all of a sudden you start looking at their reports, it's like, oh wow, they're like treating a case. Like Dr. D's case acceptance is through the roof, you know. Whereas other like newer doctors, it's like a little bit lower, and like I just go talk to them, like, what's going on. You can't be overly clinical. You can't be overly academic, because the majority of your patients are not like that. Now, that doesn't go to say that you might get like a neuroscientist or a president of a hospital
who want to hear every single little detail.
And again, too, it comes back to the types of patients. But the majority of patients that come in there, they just want to know that you care. They just want to know that you're in their best interest, and you're not trying to rip them off.
Do you have like some sort of protocol? Because I know a lot of people say like, okay, find 3 things in common with the patient, like when you first meet them.
I don't have a system. I mean, you walk in there, you look them in the eye. Hi, nice to meet you. How are you? Why are you here? What can I do for you? What brings you in? And then you ask questions, and then you ask questions after questions, and you want to get the patient talking, because once they're talking, then they start to become comfortable. They're like, wow, I can express myself to this doctor. He's not just like somebody that's higher up. Like, I can actually, he's listening to what I'm saying. Because believe it or not, we don't even think about it because we're all doctors. But when a patient's in the chair and a doctor is really listening to what they're saying, it means a lot. It really does.
Yeah. It's all about, I think, confidence too, which takes time, because the patients can sense if you're not confident. But, and it as a new grad, it took me a little bit of time to like get that confidence, and because you don't know the best choice sometimes, whether something's going to last, whether something's not going to last. But for me, it was always, what I always kept in mind was like, this is my brother, this is my sister, this is my mom, this is my dad. Would I do this? Right. That I always asked myself that, and that just guided me in so many different ways. And I talked to the patient. I mean, yeah, like he said, you need to. I mean, I love people. You need to love people, or else this is the wrong profession. Absolutely. So you're in there. I want to know like their kids, where they're from, all that. And I genuinely do want to know that. Whereas a doctor that kind of just goes in there and is like, all right, it's going to be root canal buildup and crown, and treatment plan coordinators coming in. They're going to be like, what the heck? Do
you guys present your own cases to the patient, or how do you do it?
So sometimes, another thing too that I forgot to mention, obviously no brainer intraoral camera. Like you absolutely have to have photos. A lot of times too, when I come in and I feel like I'm just initially getting some pushback, I'm basically like, listen, I'm not going to say anything. I'm just going to take a photo. And I'll be back momentarily. And I come in, I pull it up on the screen. I'm like, so what do you think about this? They're like, oh my gosh, is that my tooth? And then you can kind of go into that, as opposed to, going the other way. We kind of tell them what they need, and then I was like, we're going to itemize the treatment plan, and we're going to get the cost together, so you're going to know exactly what, your financial responsibility is. We're not going to get any surprise bills going away. But then we do have treatment plan coordinators, like the moms of the office, just like these loving moms, and they come and they, and they sit down and they, they'll really talk to it, and they answer all the questions. Our treatment plan coordinators are as knowledgeable, as a lot of dentists.
Absolutely.
So that's kind of the process that you have to have. There's also like the handoff, when everyone's consistent. When you come in, it's like the assistant is like, oh wow, I think this is going to need a root canal, and then the doctor comes in and, oh wow, I think this is going to need a root canal, and then the treatment coordinator comes in and says, you're going to need a root canal, and how much it costs. Once there's that consistency, it's like all of a sudden, wow, like the patient's like really confident in what's going on, as opposed to getting missed signals from everybody.
So I guess it
a
also
sense of trust.
Sense of trust. I guess it also takes time to get everybody on the right track, right? So what's if you guys can remember something recent, a recent case you might have had, what's like an analogy or something that you might have used to help a patient understand a case? So like one I heard, what's his name?
With the root canals and the
Dr.
termites.
Dental Nacho. What's his name? Paul Goodman. Yeah. He said that a crown is like a hard hat, and he just went from there. So
I call crowns. I say a crown is a ceramic helmet that's going to protect your tooth. I always call it a ceramic helmet, because you say crown, like, oh gosh, crowns are so expensive. But then when you say it's a ceramic helmet that's going to help you from not losing your tooth or having to go through surgery or root canals, all of a sudden like, oh yeah, a helmet, it's going to protect my tooth, and then the value is built there. But I think Dr. D probably has like some other stuff too. That
off the top of my head, like when you're trying to like explain like a root canal and why it needs a crown, I do use the same analogy as ceramic helmet, but we're basically hollowing out the tooth, killing the nerve. Like I try to keep it as layman as possible. What else?
Because like right now I'm trying to write like this. I know it sounds ridiculous, but I'm trying to write a protocol and just like have a bunch of analogies for each different treatment, right? And just like pass it out to all my classmates, and just try this analogy with the patient, like see which ones work, that sort of thing. So another one is like caries is like termites.
Yeah.
And
Yeah.
eating the foundation, it ends up you're gonna need a root canal, like all that sort of thing.
Those are definitely useful. Patients like really pick up on that. Like for a tooth, if there's a bunch of fillings and we keep doing fillings, I usually tell them, I was like, it's like patching a tire. We can keep patching this, but the tire's gonna blow.
That's good. That's perfect. I love that.
Or like you see always the class 5s, like the fractions, the deep F fraction. I'm
Right.
like, okay, listen, like this is like a tree, and we're notching the tree.
Yeah, that's another good one. Those are two good ones. I've never heard those before.
Notch in the tree.
Notch in the tree.
I haven't even heard that one before.
Yeah.
Touche.
That's a
Like,
good one.
you know who? Speaking of this, Dr. Greg Charles. He's the
Oh
one,
yeah.
the dental clinical pearls. I forgot that.
Yeah.
That is such a big free foundation for pearls. But he also has like a course on like case acceptance basically. And I haven't gotten it, but I know this is like he just dives into all his scripts and stuff that really help patients understand. So that could be a useful.
He also sends out emails. I don't know
Yeah.
if you get
I do.
every day or something.
The helpful
and it only takes like 60 seconds to read.
Yeah, the helpful dentist. It's great.
Yeah. Okay, so Dr. Kupperman, I guess we're skipping around a little bit, but how do you get your practices involved in the community? Because I see you go to a lot of like community events, that sort of thing. So what are some of the things that you're trying to focus on there in promoting your practice? Is there anything that you have any goals in mind, or?
Well, one of the biggest things is just local philanthropy. I think we recently went to, it was like a big breast cancer, what was it? It was a big breast cancer, I guess, celebration of the survival. So I ended up, getting a table there, and we did, some auctioning and some bidding. So that was pretty fun. Dr. D and I are really big on mission work. So locally, we volunteer at the local homeless shelter, but also internationally, Jamaica, there's a really good outreach program that we do there. But yeah, I think that's one of the biggest things. You got to be involved in local philanthropy. And the thing is, too, is a lot of these philanthropic events, they're fun. They're a good time. So
Right.
you can kind of involve staff. You're like, oh, hey, like who doesn't want to go to a nice banquet and like have a dinner and enjoy and like network. So it can be fun at the same time.
That's really cool.
And even like the rural offices too is what we've started to do is like there's church events out there that we kind of have to go to.
Trunk or treat is a big one on
Trunk or
Halloween.
treat.
And everybody tailgates with their trucks. We get like our Morganell truck out there and like handing out candy to all the kids. So
You got to be involved in the community. People want to see that and that you're part of the community, or else you're just an outsider.
Right. That's cool, guys. So, what's something when you got out of school? Give me some like CEs that really set you to the next level. What are some procedures that we spoke before about endo? Like you really got into endo, and Dr. K, you got into surgery. You really enjoy that, implants. What are either some CEs or just some things that really elevated your clinical skills?
For me, I did I think the Brassler continuing education course I did. It was in Destin. It was sponsored by Brassler, which we used the endo sequence, endo stuff. That was really good for me because, Dr. Kupperman was in my ear saying, this is the BC Sealer stuff's really good. And even at Nova, like a lot of the doctors were starting to come on board with that system, real world endo, like all the spear guys, like that's the system they use. But that like helped me understand like the science of it and why it's good. But it also helped me like technique wise. Like there was an endodontist there that went over like the blend technique or like, kind of broke it down to like a really simple way. So then I implemented that here, which we weren't doing something too different. But when I started doing that here, it just like it helped me become more efficient. And then as far as CE, the online oral surgery helped me a lot. Just for some of these these extraction cases.
Right.
And we also did in Las Vegas. Went to one of the big business Cs,
Mm-hmm.
and
the Dental Whale Conference.
Dental Whale
no.
Conference.
You guys
That was like all the big names there, man.
Yeah.
It was great. It was awesome.
And
You guys
going,
meet Scott Luna?
Yeah. I've been to the breakaway practice. Yeah.
But like going there and like rubbing elbows with all these guys, like not only just the course and stuff, it was just cool to to talk to these people and kind of see like the bigger picture of where dentistry is kind of going,
Right.
and how things work, and so that was cool too. That was more like just like a mindset shift for me, not so much clinical, but just going. It doesn't matter what CE you go to. Like you're always going to just grab that one little thing,
Right.
And then you're talking with dentists, and whether you're like, oh, like, like you're just venting or talking, it's like it's invaluable. Like so,
Right.
I think I'm big on CE. I think it's absolutely necessary.
Scott, or not Scott, Dr. Paul Etchison, we interviewed him a few months ago, and he said that the guys who are doing the best, that are producing the most, that are becoming the most successful dentists that he knows, are all CE junkies.
Yeah.
So, like that, I mean, good for
Yeah.
you, because you guys are definitely killing
It
it.
pays dividends, yeah.
But
Yeah.
I mean, Pankey, Dawson, LVI, Spear, did some courses over the PICOS Institute for Surgery, for implants. So you need to. That's one thing too that I think Dr. D and I can agree on. You need to adopt a philosophy. Are you LVI? Are you Dawson? Are you Spear? Are you mixed? Like, just figure out what philosophy you like and can grow on. Because you don't want to constantly be changing your
Right.
occlusal philosophy and this and that. Because like neuromuscular dentistry and centric relation, they kind of are counter. They're completely the opposite thing. So you got to find out what works for you, and again too what you're passionate about. So
Right. Is there any specific implant system that you like? Like, I know a lot of people like
I'm a
BioHorizon.
huge proponent of Straumann. Yeah, I mean, if you're gonna do implants, just do the best.
Yeah.
I mean, I've done some some other implants which I will not name, but it's not the same when you see these Straumanns and they've been around for 10 years and the crestal bone is just still perfect, and then you'll do another implant like perfectly. Perfect everything, and then 4 months later you're getting crestal bone loss. You're just like, what's going on? But I like Straumann. I like the system. I've gotten so comfortable with it, and they just integrate. They have a really high success rate. I mean, you can go on PubMed and you can look at the research articles of the thousands of implants they place, of like the 99.5% success rate. I mean, there's some really good backing, and that's why like all the periodontists and all the oral surgeons. I mean, they're high on Straumann for a reason. So, and I mean, I'm not paid to say this either. I owe a lot of my success to Straumann because they make me look good. If I'm placing implants that are failing, I look like an incompetent clinician. But
Right.
Straumann it's been good so far, and it's been really good customer service. So
Awesome. That's some great advice, guys. I appreciate that. So, final thing. Dentistry, that's one part of our lives, right? So how are you guys kind of balancing everything with your family life, all of that? Tell me, like, what's your guys' plans for the future? Like, do you plan on having kids? Do you have kids? Tell me a little about that.
At the end of the day, it's we got to start a family. I'm single. My family's all in Michigan. So right now it's I'm kind of I took a kind of a chance coming here. I've made friends. I made a good support group through Dr. Kupperman and stuff. Like, I love it here. But it's we're gonna see. I don't know whether whether I stay here for my plan. I mean, eventually down the road is I want that 4, 5, 6 chair office, low overhead, lean,
Right.
and doing my thing. But at the same time, I'm seeing what's I'm here working with in the group setting, and the vision with Dr. Kupperman. It's also very it's awesome because you have a doing dentistry by yourself. I feel it can get kind of lonely, and like being here and having different doctors and doing it all together, because you need people to do stuff. So right now I'm just trying to get more confident, clinically capable, and then we'll see.
Awesome.
Me,
Yeah.
one day at a time for me.
Yeah.
What about you, Dr. Kupperman?
So personal life, I like to be relaxed. I like to enjoy life. I mean, it's kind of funny. Like, a lot of those doctors recently kind of started playing tennis, and it's like you're just having a blast. Like, I like going for long walks. I like beautiful weather. I like being out in the sun. I have a girlfriend. That's been going pretty well. I mean, I'm not trying to rush anything. I mean, I feel like Dr. D and I were in a very fortunate situation. We're both young, and we have a path for success. So, but at the end of the day, man, you want to be enjoying your life. You don't want to be killing yourself. And as for the future, I really feel like Dr. D and the other doctors that I have, I think we have something really special. I think we have something unique. I don't know what it is, but deep down inside, like the pit of my stomach, I feel like we have the potential for greatness. I mean, I'm at 5 locations right now, but I feel like if I find the right people, there's no reason why we can't grow much larger to be in comparison to other groups. Because this whole philosophy of adopting relationship-based dentistry, not just with the patients, but with the doctors. you have to respect the doctors, you have to have a good relationship with them, and you have to mentor them. And I think that's kind of the basis of our organization. And that's why I don't necessarily want to jump into a family. I don't want to jump into kids and whatnot, because I still want to focus on just growing this special thing that we've created here. So that's where I stand.
It's almost like you already got a family, right?
Yeah.
Pretty much.
Exactly.
What about going outside of the panhandle of Florida? Like, would you consider going to Alabama, going to South Florida?
Not South Florida, obviously, for many reasons. But maybe, I don't know, South Georgia. I just love the South, man. I like that. I like that Southern hospitality. I like nice patience. I like slow pace. I like relaxed. I know it. I think for a lot of dental students, you're probably like 25, 26 when you get out, and you just like want to rage. You want to go to like the city. You want to be in New York. You want to be in San Diego. You want to be in Miami. Just like going ham essentially.
Yeah.
But I'm 31, pushing 32. You'll notice that as you kind of start to get to your 30s, you get your creature comforts. You kind of start to relax a little bit. Yeah.
What is it about Tallahassee that you like the most?
I think it's just because I see the potential of Tallahassee. It's booming. I mean, there's just hundreds of millions of dollars of development going on right around us right now.
That's true. You can see it when you drive around.
But that you would never even know. And I think the potential for Tallahassee, I think we're going to follow a similar timeline to Austin, Texas, because they had basically the exact same timeline of just being that small football town, and then it kind of slowly just grew. But I see a lot of potential. And again, too, I love FSU, but I like the people here. I like the community. I like, I just have some really good friends here that I trust.
Right.
It's nice being able to trust people. And again, too, it all comes down to the relationships you have at the end of the day. That's like, there's tons of podcasts and stuff, but it's just a study on happiness. And it's like, what's the correlation between happiness and fulfillment in your life? And at the end of the day, it comes down to relationships. So where are you going to be where you're going to have good relationships with people? If there's kind of an emptiness of being in a big city and just meeting people and they're leaving, they're gone. It's like you don't know them. It's fun in the moment, but at the end of the day, what's going to be lasting and fulfilling? So that's why I implore you to consider where you want to be located going forward in your career for dental students and existing guys.
Do you feel that it's a transient town though because of the college that is here?
For students and for patients, for the FSU office, yes, but for a lot of my other friends, I've known them since I moved here, and it's kind of funny too. We kind of have a saying in Tallahassee. It's kind of like a boomerang. You leave, and a lot of people they kind of end up coming back.
Yeah,
just how Tallahassee
is. I love it,
is.
man. Love it here. Love it here. All right, thank you guys so much. Any contact information for anybody to reach out to you guys?
I'm on Instagram and Facebook, just Nathan Kupperman, DMD. You can check out our website at nakdentalgroup.com. If you have any questions or concerns from me, my email is nkupperman at nakdentalgroup.com. My last name is Kupperman. Cup, like a cup, yeah.
If you guys want to talk, have questions, you can email me, Calogero D'Anna at me.com. That's CALOGERODANNA at me.com.
Awesome. Thank you guys so much. I appreciate it.